Oh, there's a little bit of impaction happening there too. We'll deal with that, which is a big, hard, lumpy nodule down here. So we're going to deal with that. But he has somewhere.
Hi everyone, I'm Lynn from Cavy Central Guinea Pig Rescue.
Okay, so now we have piggy number 2, who is much larger but the same age. Piggy number 2, we're going to again bath because we know mites are present. They would be on this animal, but they're just not as prevalent because of their immunity. So he's much healthier, and that's enabling him to hold off on them going to town basically as much. So we're still going to bath him and treat him exactly the same. But the other thing we're going to look at with this little guy is that he has a sebaceous cyst somewhere. Oh, there's a little bit of impaction happening there too. We'll deal with that, which is a big, hard, lumpy nodule down here. So we're going to deal with that. But he has somewhere here, yes, here we go, a sebaceous cyst. Now, what I've always found with sebaceous cysts is that they do not impact immunity, and you can see there how it is just sitting, and it's been there for some time apparently. But what we're going to do is just clear it back so we can really see it properly, and then we're going to clear it out properly. We're going to treat that little cyst. So by bathing him, we'll be treating his skin with an antifungal, which is Malaseb, but at the same time the warmth of the bath water will soften what we're going to look at there. So let's get him right into some bath water. We can start softening. There we go, little guy. Yeah, let's just start softening that. Then it will come away really easily as well. So now when we're doing that, let's give you a little bath. Clean you up. We'll also deal with that impaction, which impaction, as they get older, depending on what their diet is, they start to lose some muscle tone, and they can retain fecal matter, which gets compacted in the anal sac area. They can pick up debris. There tends to be 2 types. One is related to diet predominantly, and the other is related to lack of water. In this case, these guys have got lots of water. It's more dietary and age having an impact. So first of all, let's deal with the impaction. Okay, so to do that, we just literally keep him in the water. We're going to move that anal sac back. You can see it's quite a large, it's quite a large lump there. So a few little poops came out because the poop is coming around this lump. But this lump, which is pretty uncomfortable, is just sitting there, all dry and hard. Look how hard it is. See if we can soften that little fella. Yeah, as we get some moisture there, it starts to soften and it will come away. We literally don't need to do anything to this area. The sac itself is lined with smegma, and it's really important not to disrupt the flora that's there. Now, this water has a little bit of Malaseb in it, which I have found doesn't affect this area much at all. So in that sense it's good, but that lump has now gone, which is great. Okay, and it's very, very dry. That lump is solid and hard, so all compacted. Yuck. Okay, we're getting you out of that water. And I'm going to change my gloves before we deal with this little cyst. Let's just pop you in here. You can eat some grass. Oh yeah, you can have a little munch of that just while I cover you up. I'm going to change these gloves. Oops, there we go. This water. Let's get these ears just wiped out. They're getting a thorough makeover. And this is what you need to do with all guinea pigs. to ensure that they are really well and healthy. Yeah, these boys look really, really good, but it's easy to mask little issues like this, isn't it? Yeah. A lot of people talk about, you know, boys and having to check their bottoms all the time. It's really not something that we need to interfere with if they're doing really well, but it's in little checks like this, you see that, oh, he's got some retained impaction, so then we need to just clear that out and then let him do what's normal in re-establishing the normal biome for that area. Does that feel good? Yeah, does that feel good? Okay, all right, we are now going to look at this little cyst. Let's see if we can turn you around just here, and put some grass down here so you can keep munching. Okay, you keep munching that way. What we're going to do is literally just see if now that that's warm it'll move out, which it will. Okay, it is. It's all moving out. It's a bit uncomfortable while it's being squeezed. You can see he's jumping around a bit going, what are you doing? So they don't like it being messed with. Sorry, little fella. We're just going to see if we can get that all out in one go. And that's without doing anything other than warming the area, because this has been sitting here for some time. Apparently it has been cleaned out before, but it very much depends what you're cleaning it out with and how well you do this process. So you can see we've got a lot of stuff coming out of that little cyst. A lot of it is in fact the cell wall, which is great. That's what we want to see. It's normal to see that. Good boy. You stop eating down there. You can eat this way. There we go. The contents of these sebaceous cysts, even though you can see some blood in with it, it doesn't tend to have nerve endings. So there's no feeling within the actual content of a sebaceous cyst. Of course there is on the skin and the edge where I'm pressing, and that's, you know, that's really not nice. So we need to make sure we get all of that sebaceous cyst. It's come out so well, so well. There we go. Just making sure all that tissue is coming out. Good. It's come on so well. And so part one is making sure that the area, you can see he's munching happily away there while I work on that, seeing that the area is completely clean and that we can easily remove the contents, not leaving behind anything that shouldn't be there. And then lastly, using a disinfectant. Still got a little bit more there. You can see it now. That's it. This is part of the cell wall. That's just the wall of the sebaceous cyst just coming out. So just make sure that does come out. That's great. There we go. Right, and then last but not least, what we do is flush that little hole, that's it, with the same disinfectant. Now, we use a disinfectant called Debrazol, and I recommend this over betadine for sebaceous cysts and abscesses because it deals with necrotic tissue. So by the time you have actually finished, you will end up with a very neat area that looks like this. You can see it's literally a little hole that has been completed. Just making sure we've got all the edges. That's it. Looks very good. One more little flush. That's what we do. We can see Piggy's munching away happily. We're going to leave that to close. And this Piggy is ready to go. Oh. You're such a cutie. So we'll update you in a week's time. And I hope you've picked up something to look after your guinea pigs today. Okay, take care everyone. Bye for now.